It's the cutting-edge cosmetic procedure that doesn't involve any cutting at all.
How you inject can create a really natural-looking appearance.
Find out why more and more patients are picking sculpting over surgery. Coming up on America Now with Lisa Gibbons and Bill Rancic, the show that delivers you the news you can really use.
Hey guys, welcome to the show. I'm Bill Rancic.
And I'm Lisa Gibbons. Really nice to have you with us.
Plastic surgeons are on the cutting edge of a new frontier. Now you can get a nose job or a chin job without surgery. It's cheaper, faster, and the results are, well, you tell us. What do you think? These are the before and after shots of people who have had non-surgical procedures to change their looks. Doctors are now injecting new so-called fillers that mold trouble areas without the pain and scarring of surgery.
This is an example of chin augmentation. So I injected filler into the chin here and brought it out this way.
Dr. Alexander Rivkin of Los Angeles says using injectable fillers often gets better results than traditional plastic surgery techniques.
The nice thing about these filler procedures as opposed to something more surgical, such as a chin implant, is that you have very tight control, so you can create a really natural looking appearance. It's more difficult to do using an implant.
Dr. Rivkin says the effect will last about a year, but the FDA has just approved a new product that will last about 2 years. Now, how about the nose?
So this is a typical Asian patient that I see, but her concern is that the bridge of her nose isn't as defined as she'd like. So this was a non-surgical rhinoplasty. What I did was put filler into the bridge of her nose in very specific points and bring that bridge up very naturally so it's a straight line and makes her nose more in harmony with the rest of her face.
The effect will last 10 months, but if the patient likes the look, Dr. Rivkin can replace it with a filler that lasts many years.
Currently, studies take it out to 10 years and it's still doing well.
Dr. Rivkin says the fillers are safe, but be sure to do extensive research before any procedure. Dr. Rivkin says in-office nasal procedures start at $1,000.
While traditional rhinoplasty can cost about $8,000.
Plus, this plastic surgeon gives pointers on how to turn back the clock without surgery.
Over time, pushes back the aging process.
Forget drastic plastic surgery. The new trend is to plump, not cut. Doctors now have a whole new arsenal of non-invasive anti-aging procedures. Here's more from the Fountain of Youth forefront. As you age, your face starts to sag, and you can look just plain tired. But Los Angeles cosmetic surgeon Alexander Rivkin says the newest way to look refreshed is to plump up the face.
What's new in anti-aging is volume. And this is something that people are just beginning to really comprehend and really figure out how to treat.
Dr. Rivkin claims the trick is to start with cosmetic injectables early to get ahead of the aging process. He showed us an example of twins. The twin on the right has had treatments, the other has not.
And you look at over here and you see these kinds of lines, these wrinkles that are starting up with this twin that just aren't there in this one.
It's about stalking the wrinkles before you own them.
And it's something that, as far as prevention goes, is a really nice idea. Small doses, over time, pushes back the aging process.
Medical science has recently come up with a product that actually acts like a fertilizer for the skin.
That injectable, we've seen now successfully, causes collagen growth in anybody you inject it in. You get stimulation in that collagen that lasts for quite a few years.
And the FDA has just approved a new product called Voluma that has staying power.
What Voluma is used for is volume. That's the product you use deep, and it lifts everything up, and it stays for a very long time.
Rob Hernandez is 46 and has had injections on his cheeks, around the nose and mouth, his chin, and under the eyes.
A surgical facelift seems so intense, and the effect of it, for me, seems kind of pulled and tight, and I want it to remain as natural as possible.
Dr. Rivkin says most people are good candidates for these injections, but do your research, study before and after photos, and read their reviews. Doctors say injections like Voluma could cause swelling, bruising, and/or tenderness.
And while these are common side effects, all the more reason to make sure you are in the care of a board-certified professional.
All right.
Hi again.
How are you?
How you doing?
Good. We started with working a little bit on your nose, right?
Yeah.
So what is it about? Sort of. I mean, you saw a whole bunch of people coming in, getting, raising their bridges. A lot of Asian girls coming in, raising their bridges, and so what prompted you to get it done? Yeah. Right.
Well, I really didn't need that big of a difference.
Yeah.
And it took me a little while to feel comfortable with actually wanting to change my appearance.
We never really considered having surgery, right?
I've always sort of wanted more definition on my bridge because I always had a problem wearing sunglasses.
Okay.
And that was my number one problem.
No, what do you mean when you say you had a problem wearing sunglasses?
They wouldn't sit on my nose. They
Okay.
would just kind of sit on my cheeks.
Okay.
And even regular glasses, were always falling down.
Okay.
So, because I worked here for so long and I saw you perform your procedure on many, many Asian women and men, I finally felt comfortable enough to, okay,
Yeah.
this is what it's going to look like. Now I can, feel comfortable about, putting Radiesse or a temporary filler in there without really altering my appearance.
So we did it, and it turned out well. And then that was like I have a chart, but it was a few years back. Like it was like 3 years ago or something like that. 2 years ago.
Maybe about a year and a half to 2 years ago.
Okay, and then we've been doing little touch-ups since.
Yeah.
So sort of maintain the appearance, not. So we haven't let it come down all the way. We just sort of when it starts to come down, we do little touch-ups. This is the point here where it's come down a little bit. So we want to fill this point a little bit. So we want to fill this point so we get the straight line again. And then I think what we want to do is, because you're saying that you want a little bit of a slope still, I want to raise the tip a little teeny bit so that we get just that little bit of a slope coming up, but a nice smooth line. This area right over here in the cheek, this is a little area in the cheek, because there's a little teeny bit of volume loss where we can replace it. And the reason that I want to use Perlane is that it has good density, good structure, so it'll stand up to the cheek, but it's still reversible. It's still hyaluronic acid, and it's still reversible. So that's nice. And it's interesting with you that the volume loss of your cheek is actually, it's not very evident until you smile. And then when you smile, you get that little bit of a line right over here, right over here. And then when we fill that in, it's not really nearly as noticeable. Yeah. So hands, and then the other thing that Allie's going to do is tap on the other side. She's going to tap her shoulder or your hand, distract her from what I'm doing here. Okay, little stick right here. Okay, so that's nice. Now as I inject, in terms of technically speaking, as I inject, I always stabilize the syringe. I always have one finger on either her chin or part of her, or her lip, or I always have a finger that's stabilizing me. So in this case, it's my pinky, and I'm resting it on her chin. I have as many fingers on the syringe as possible so that that's stable as well. So this way, the only movement I'm making is very, very small ones to bring the needle in, and also to push the plunger down. And so that way I can control very precisely how much material actually goes under the skin. The other thing I'm doing is, with my other hand, I'm holding the bridge of her nose, and I'm I have a little bit of pressure on the area where, just above where I'm injecting. This is the area that I don't want the filler to go into. So if I guard with my other hand, I know that the place that I inject the filler is the only place that filler is going to go. It's not going to go up higher in the nose, and I'm going to get the kind of cosmetic effect that I really want. Okay, so turn profile for a second. So you see already that we have a little bit of a lift to the area that we injected. So now it's already more straight. And so what I want to do now is accentuate the tip a little bit so that we get a little bit of a curve. Ice the tip of your nose.
Damn, I thought that was a tip.
And the tip of the nose is really the part that's the most tender, but the injections are very quick.
Yeah.
And it's over in a sec.
Yeah.
Okay, go ahead. Okay, a couple more, we're done. Okay, we'll stick here. Good. I think that's all we have to do. Yeah, I like that. Nice. It's a nice little slope to it. Smile. Do the little monkey face thing that you just did. Yeah. No, down. Yeah. Okay. It's a little bit of a dip here. Okay.
Monkey
Nice.
face.
Do that again. Sorry. Okay. One more. Good. And then when you inject with the nose, you have right afterwards an opportunity to mold the filler and put it in places, into the places you need to put it into, and have it kind of spread it out a little bit so that it's nice and smooth on the contours. It's a nice property of most of the fillers, and including the radius. Good. Okay. And because it's anytime that I look at someone's face, I'm always looking at someone's face in 5 different angles. The 2 profiles, the 2 obliques, and the front on. And so right now, with the obliques and the profile and the front on from this side, it's good. So now I just want to go around to the other side, make sure it's nice from this side as well. Good, and from this side as well, it's nice and smooth. So at this point, go ahead and ice over here. And so what we'll do now is we'll go on to the cheek. I have people ice right beforehand, not a little bit for comfort reasons, but also really to decrease the chance of bruising. The ice should shrink down any kind of blood vessels that are under the skin and have the chances of me hitting them be considerably less. And also, I will tell you before I check. So same as before, where I try to brace my injecting hand either against my hand or against her face. I have one finger, which is this one, guarding up top to where I don't want the filler to go, and then I have my thumb on the left hand underneath here, also just sort of having control of the skin, so I know exactly where things are going, and that there's I'm injecting into her skin as it lies anatomically, that I'm not pulling it one way or the other and injecting into a place that I'm not that I don't expect to do. Okay, go ahead and close your eyes. Okay, little stick here, and I go in slowly, slowly, inject slowly, slowly. Good. Okay. Open your eyes for a sec. Okay, that's better. A little bit more. It's closed. Stick. Okay, sorry. Okay. And again, there's an opportunity to mold right afterwards so that things settle into the right place. Last one, I'm going to put still a teeny bit in here. Okay. Good. Okay, smile for me for a second. Relax. Do it. Smile big. And relax. Okay, take the ice, put it right over here. Just look up. Now, when I'm injecting around the eyes, when you have someone look up, it rotates the eye, the globe up, and you can really see if there's volume loss underneath or not. Because when you look straight, you rotate down and it's a little bit fuller, but when you look up, you can really see the extent of any kind of volume loss. So look up a little bit, and I see that I need to do just a little touch over here. Okay, close. Smile. And relax. That's good. Good one. That's it. Okay. Smile. Good. That's better actually. Relax. I don't see that line coming down anymore. Mm-hmm. Just have a little touch left. I'll put it right in here. Cool. Good. All right. Good job. That should be fine. That's it. Okay.
Thank you.
Good.
Hey, 10 years younger.